A study by Mental Health America shows that Tennessee ranks among the worst states for access to mental health care. Tennessee ranks 43rd on the list.
Today, we are sharing the story of a local woman and her family's struggle to find and maintain the care she desperately needs. Heather Holly has her story.
Her name is Chelsea Barnes. She is the most beautiful, loving, kind person I have ever met.
Cassandra Turner says her daughter was an amazing and kind child whose life wasn't easy.
We lived from house to house sometimes, homeless, motel to motel.
As Chelsea got older, her behavior and mental health declined. Chelsea was in her mid-20s when she started hearing voices.
She started getting into drugs. You could really see the decline.
Cassandra says she and her husband are recovering addicts. They told Chelsea she had to stop using drugs, and when she didn't, they kicked her out of the house.
And I thought, tough love would be the answer. But sometimes tough love doesn't work. When it comes to mental illness, it just made it worse.
By 2021, Chelsea was diagnosed with schizophrenia and living on the streets. At this point, she encountered Chattanooga police officer Brandon Watson with the Crisis Co-Responder Unit.
It was a cold January, and at that time she was a missing person. Nobody had seen her for years, and she was not able to really articulate anything.
Officer Watson helped Chelsea get into a medical facility. This would be the first of many encounters he'd have with the young woman.
She was on this cycle: jail, ERs, mental health, the mental health hospitals, back to the streets, back to jail.
One hot July day, Officer Watson responded to a psychiatric emergency call on the Market Street Bridge. It was Chelsea.
And she wasn't having a mental health crisis. Her feet were so charred from the hot road that every step was agonizing pain for her.
Officer Watson put Chelsea in the back of his patrol car and gave her some water. But then something different happened.
She was able to give me her aunt's phone number in that moment.
Up to this point, Chelsea wasn't able to communicate like that with Officer Watson. Now he was able to get her back home.
I was like, whatever happens tomorrow, don't let her go back to the streets.
Unfortunately, Chelsea's story doesn't end here. Reunited with her family.
Then all of a sudden, I think it's probably been a year and a half, she turns back up again.
Chelsea was back on the streets, and her mental health had deteriorated even more.
She had developed a new thing where an entity was possessing her and causing her to severely injure herself. Severely. To the point where she was unrecognizable.
Officer Watson called Chelsea's mother, and together they took her to Joe Johnson, a mental health facility in Chattanooga that includes a walk-in crisis center.
They did an assessment and got her back to an ER, and then she wasn't there less than 24 hours, she was back out on the street again. And so my guidance to the mother was, keep doing it.
And that's exactly what Cassandra has done.
She has been in and out of Moccasin Bend. She has been in and out of probably every hospital in Chattanooga.
Chelsea was admitted to Moccasin Bend in May of 2023. She was released in November when the facility told her family she no longer needed hospitalization.
And that's when it spun out of control when they released her.
In December, Chelsea went to a halfway house. While there, she hit someone and was arrested. Her mother says Chelsea was put in isolation in the Hamilton County Jail.
She ended up beating her head against the ground. And she's got a split right here where she almost killed herself.
This is body cam footage from a call involving Chelsea on May 7th. It's blurred because it's inside a medical facility.
You're arresting me.
In the video, Chelsea tells Officer Watson Moccasin Bend released her after being there one day. She's still wearing a protective helmet and mitts. Once she was released, her mother took her back to Joe Johnson, where she tried to hit an employee.
I can't quit hitting people, and I don't know what to do. I'm a really good person, but then I have like a bad side. The voices.
Officer Watson responded and took Chelsea to the emergency room to be stabilized, but she was released again.
We just keep running the cycle, and hopefully something sticks. And my opinion is that's not care. That's gambling. And we're gambling with someone's life.
Cassandra doesn't know what to do next, but she isn't giving up on her daughter.
I'm going to keep fighting. Doesn't matter what I got to do. I'm going to keep fighting for her because she deserves to be fought for. Because she can't fight for herself.
It's almost like they're screaming into the void. And it's heartbreaking.
Heather Holly with that report. Chelsea's mother says she's been in 6 facilities at least 10 to 15 times since April, and she is still trying to find long-term care for her daughter. We'll continue to investigate the major hurdles of accessing mental health care. Watch for that report on air and online.